Well, good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikulu. First, the highlights. The mission to avoid a deadly third wave is still on, and latest figures indicate a rise in the number of infected persons as the NCDC preaches more collaboration on risk communication. The Benue government responds to questions on the backlog of COVID-19 cases just reported in the state and how the state of security may be affecting its response. UAE government approves the emergency use of a monoclonal antibody therapy with hopes to reduce cases of hospital admission. Well, aside adherence to non-pharmaceutical interventions, or do I say the lack of it, Nigeria's government is grappling with another huge challenge: the uncertainty of vaccine supply as a result of global shortage. Well, the Minister of Health, Dr. Sage Ehanire, disclosed this during a weekly presidential media chat, saying that Nigeria is looking to get vaccine donations from the COVAX facility and other countries who no longer have need for their Oxford AstraZeneca vaccine in August at the earliest. And for local production of the COVID-19 vaccine, the minister says this is not feasible just yet, owing to the high cost of conducting clinical trials, which run into millions of dollars. Or regarding funding, he indicated that there is no supplementary budget for now, but declined to disclose the country's financial commitment towards procuring additional vaccines.
Observing non-pharmaceutical interventions remain an effective way to fight the COVID-19 pandemic. The Nigeria Center for Disease Control is asking all caregivers and persons involved in patient care to ensure hand hygiene at every point of care. Nigeria has recorded 25 new infections in the last 24 hours, slightly higher than the 17 recorded a day earlier. According to an update by the NCDC, Lagos had the highest figures with 10 cases. 9 cases were recorded in Taraba. Kaduna recorded 3, while Rivers and Kwara had 2 and 1 case. Clarifying the figures, the NCDC says the latest figures also include a backlog of data from Taraba State from March 21st till date. The latest tally raises the total number of confirmed cases in Nigeria to 166,560. 11 persons were discharged after treatment in the last 24 hours, raising the number of recoveries to 159,946. There were no casualties since the last 24 hours, leaving the fatality toll at 2,099. Over 1.9 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while over 148,000 of those vaccinated with the first dose have now received their second. More state governors have also received their second dose of the COVID-19 vaccine. In the latest update by the National Primary Healthcare Development Agency, Lagos State is taking the lead in the second phase of the vaccination exercise after vaccinating over 27,000 of its eligible population, followed by Benue and Kano. Globally, the number of confirmed cases stands at more than 171 million people, while more than 3.5 million deaths have been reported from several countries.
The federal government's One Health Strategic Plan 2018 to 2023 places a high premium on the need for awareness and collaboration among stakeholders, including the media, to strengthen Nigeria's health security. Well, in Lagos, the One Health Capacity Building Workshop for Risk Communication among One Health stakeholders is taking place, and Channels Television's Millicent Walker is a participant. She now reports.
Indeed, Kayode, the success of any disease outbreak and control is largely dependent on participation of the public, the accurate knowledge of what they need to do to protect themselves, and the right attitude towards compliance to protocols. Risk communication and community engagement is key. And this is something One Health seeks to achieve with media stakeholders' involvement, which is critical to the success of our collective response.
One Health is a kind of a concept to bring human health, animal health and environmental health together to ensure that we have a well-balanced society to improve the health of human, to improve the health of animal in a healthy environment. So this is to ensure that we don't work in silo. We all come together, collaborate, and ensure well coordinated efforts to protect the health of human animals, as well as ensure that we all live in a healthy environment.
As you are aware, the public needs to take some appropriate actions to also ensure that they are safe. These actions are simple. They are the non-pharmaceutical interventions as far as this pandemic is concerned. So working with the media, we can be able to, relay some of these messages to the general populace.
This is happening right now, and at the moment, there are breakout sessions on indeed risk communication. So I'll just head over to one of the groups, and it's back to you in the studio. I'll see you later.
Well, thanks, Millicent. Away from Lagos now. Having completed the first phase, the Benue State Primary Healthcare Development Board is now administering the second COVID-19 dose to residents who already got their first jab. So the Executive Secretary of the board, Dr. Ben Mageda, says they are also mapping out strategies to reach out to those yet to receive the vaccine. In the meantime, we caught up with some residents who have taken their jabs, and they speak on how safe they feel after taking the vaccine and how they plan to conduct their lives going forward.
It's business as usual at the popular food basket roundabout at Makurdi, the Benue State capital, with both human and vehicular activities, but with little or no regard for the NCDC's safety protocols. While some residents of the state are worried about the level of non-compliance to safety protocols, some are happy to have now received the first and second dose of the COVID-19 vaccine.
We should avoid going about in crowds. We should just stay away from people. Wash our hands regularly, apply our hand sanitizers, wear our face masks, which is the safest way, because we don't know who is who. We might think that the person next to me, it's not positive, but we don't know. If the person doesn't tell you, you don't know whether he or she is a carrier or not.
Well, I am not scared because I've taken all my doses of COVID-19 vaccination. How many doses? The 2 doses, I've taken them. The last one I took it 2 days ago. And that's why I know that now I'm free.
The Executive Secretary of the Benue State Primary Healthcare Development Board speaks on the administration and management of the COVID-19 vaccine in the state.
We have done the first phase and the second phase of vaccinations. Of the first dose, we initially received 73,150 doses. We subsequently had another addition of 26,220 doses, making it a total of 99,370 doses that came to Benue State. And we're trying to mobilize people, eligible people, to come out and take their vaccines across the state. And so far, we're doing quite well.
To aid vaccine administration, the state government has provided 2 cooling vans for moving the vaccines from this cold room storage facility to the 23 local government areas. Although the figures of positive cases in the last 1 week have risen, as well as delayed test results from over a month, the Benue State government says it will not leave anything to chance in flattening the curve of coronavirus in the state.
Now, staying in Benue, earlier this week, the COVID-19 figures from the state became a major talking point after the NCDC announced 178 cases for the state. Well, there's a backstory to this, and we're joined by Dr. Joseph Ngwea, the Benue State Commissioner for Health. He speaks with us via Zoom from Makurdi. Well, it's great to have you on the program, Commissioner. Well, let's begin from some of the comments made by residents in the state just in that report. I mean, one of them saying he's not scared, basically saying he's now free, having taken the 2 doses of the Oxford AstraZeneca vaccine. Some people think after taking that second dose, they probably don't need to wear face masks and all. So if you could tell us first, what's the policy of the state regarding that? When people have taken their second dose, how do they conduct themselves?
Yeah, thank you very much. The policy still remains the same. Non-pharmacological methods of protection or prevention. Wear your face masks, improve your sanitary habit by use of alcohol-based sanitizers. And then you also avoid crowded areas, that is social distancing. So the policy has not changed. And people, even when you have taken your 2 jabs, you also continue to abide by the COVID-19 preventing protocols. Thank you.
Okay, I'm glad you cleared that one up. But let's talk about the bigger one. I mean, the backlog of cases caused quite a scare earlier in the week. Now, for some who probably didn't see the part where the NCDC said it's an accumulation of cases between certain months, but it still begs the question, why not report daily for trusts, proper tracking, and the rest?
Thank you very much. We had some little logistic problems, and there were a lot of backlog from March till May, and that was why the number came up that much. And that day, I received so many calls all over the country, some text messages that tried to calm them that these are backlog of cases that were not reported, and they were reported at once. We also encourage more people to avail themselves for testing. And we have testing centers across the state. In Makurdi, in the Benue State capital, we have at the Benue State University Hospital, we have at the Federal Medical Center, Makurdi, and then we also have at the Air Force Base. And so we also have flash points across the 23 local government area of Benue State, where we have people who are in charge of testing that can link them to the state capital and sample collections and surveillance and all that. And so people are advised to avail themselves for testing, and we just procure about 50,000 emergency kits of COVID-19. And as soon as those who are involved in the training is carried on, we distribute across the 23 local government, and we improve our testing capacity. And more cases will be identified if there are any. Thank you.
Right. So when you say you had logistics problem, specifically now, is it personnel, equipment, transport, or security? What does logistics mean in this sense?
Because of security challenges and just security challenges across the state and personnel issues, payment issues, but we were trying to sort it out. And as soon as they were sorted out, everything started going on well. So it's a holistic issue, not just security, not just trying to, payment of personnel is end to end. And all those things account for a lot of problems that we're facing. And for now, everything has been sorted out. And as we speak, I'm in the office trying to sort out more issues so that it will be hitch-free. Thank you.
Well, we certainly hope it will be hitch-free for you and other states in this fight against COVID-19. But I'd like to thank you so much, Dr. Joseph Mbia, the Commissioner for Health in Benue State, for your time on the program this evening.
Thank you very much. God bless you.
Well, the global watchdog in the fight against COVID-19, that's the WHO, is asking residents of Taraba State not to panic over the vaccination exercise, which is going on not just across the country, but across the state as well. Now, this is coming as most residents remain jittery about the safety of the vaccine and the success recorded so far in vaccinating over 39,000 residents.
Empty bed spaces at isolation center in Taraba State speaks of the success the state is recording against the COVID-19 pandemic. Over 39,000 residents have so far been vaccinated across the state since it received about 90,000 doses of Oxford AstraZeneca vaccines. However, the challenges of residents abiding by the COVID-19 protocol as well as vaccine storage still persist.
Through the support of His Excellency, in collaboration with the Gavi, we have already installed over 128 solar direct refrigerators across the 16 local government areas for the preservation of our vaccines. And I think that is enough for us to maintain our vaccines from the manufacturer up to the end user. So the vaccine we use during the first phase and the second phase are the same vaccine.
The Director of Immunization and Disease Control in the state is impressed by residents' perception of the vaccine.
But right now we are doing vaccination for those that have received phase, and we are happy with the turn-up. And I can tell you for sure that we are making progress. And evidence are emerging from these vaccines that the protective component of this vaccine is being proven to be effective now.
Representative of the World Health Organization says they are monitoring the pandemic and assures residents of the safety of the vaccine.
We have been seeing that the beginning of the rumors and other misconceptions started that even if you take the vaccine, something will happen to you. Now they have seen people has took the vaccine, nothing has happened. They now begin to raise it to another yes. So for us, people should take the vaccine. Is more safe than taking those rumors. Always they should take information of health in a right way.
Taraba State has so far recorded a total of 992 cases and ranks number 27 across the nation.
Well, from the UAE to India, we have the latest updates for you as we're joined by a journalist in India, but that's after this break. To join us again. Welcome back. Children between 12 to 15 years have been added to the eligibility list for COVID-19 vaccinations in Dubai, United Arab Emirates, with the local health authority now offering Pfizer jabs to this category. Well, in addition to its vaccination campaign, the UAE government has also approved the emergency use of a new drug in hopes of drastically reducing hospital admissions and death rates. Correspondent Maiwa Adegoke brings us details, plus a look into one of the biggest vaccination centers in Dubai.
The UAE has become the first country in the world to approve new drug sotrovimab for emergency use on COVID-19 patients in critical condition.
So sotrovimab is an antibody which is specifically designed to target the spikes of a COVID-19 virus. And these spikes are very important for the virus to attach to cells and cause infection.
Produced by UK firm GlaxoSmithKline and believed to reduce COVID-19 deaths and hospital admissions by up to 85%. To date, nearly 1,700 have died in the UAE since the start of the pandemic. Meanwhile, the local health authority has given its vaccination campaign a boost. UAE now topping global vaccination rate with 131 doses given per 100 persons.
You saw the tour, how people are interested to take the vaccine, how people are happy to get an appointment in like 2 or 3 days maximum. As I showed you, there is a possibility to enter a DHA application or call the call center for booking an appointment and to get an appointment in less than a week.
Kalfan Al-Raiz is director at one of Dubai's largest vaccination centers, which boasts a capacity of 4,000, and the entire operation runs like a well-oiled machine. Each visit takes an average of 30 minutes, including a short wait in the observation area.
We finished everything in like 20 minutes. It was really amazing. The whole experience, actually, I wasn't expecting that. But the whole experience was really good.
Well, from the look of things, if all centers across the country operate at this same level of speed and efficiency, well, the UAE government will likely vaccinate its entire population before its deadline. From here at the One Central Vaccination Center in Dubai, Maiwa Adegoke for Channels Television News.
So moving farther east to India, where the Supreme Court has faulted the federal government over its coronavirus vaccination program. Well, for one, the court wonders why it was mandatory to register on an app to get a jab when this would hamper vaccinations across rural India, where internet access is difficult. Add to that the projections for a third wave. I mean, if a second wave was this brutal, you wonder, what will the third wave look like? Well, I hate to imagine. Well, let's speak with Harish Upadhyay, a journalist reporting live from Bangalore in India. Well, thanks, Harish, for joining us. First, the Supreme Court's scathing criticism of the government's handling of the vaccination. Well, do you think this reflects the general view of Indians, not just on the vaccination campaign, but the government's COVID-19 response in general?
So the government has come under severe criticism for the way they have handled the second wave of COVID-19. First, there was this huge crisis related to oxygen. Then they had to scramble for oxygen, mobilize it from different countries, and then also divert industrial oxygen to ensure that it's used for medical purpose. But what we are looking at right now is to ensure, as the cases decrease now in the second wave, to ensure that more people are vaccinated by the time there is a third wave hitting India. And that's where the central government, the federal government, is coming under severe criticism for the way they've handled the whole vaccination program. The first criticism was the fact that probably India did not look at vaccination in a very urgent manner, did not analyze its needs properly, and that's the reason they managed to export around 66 million doses of vaccine, while only 130 million doses were administered in India during the period Jan and April 15th. After that, just to put it in perspective, around April 18th, the Indian government, the federal government, turned around and asked the states to ensure that they vaccinate the population that's between 18 and 44 years of age. And the union government, the federal government, would only vaccinate people above the age of 45. That's come under severe criticism now for multiple reasons. One, the Supreme Court has asked the government on why this arbitrary decision was made. They believe it violates the rights of the citizens to get a dose. And what is the reason that the population, which is 18 to 44, which forms a huge chunk, possibly the majority chunk in India, is not getting free vaccines? Second, India went into a liberalized vaccination policy, which essentially meant that of all the vaccine produced in India, 50% would be brought by the federal government as the union government, and the rest 50% will have to be shared between the local governments, the state governments, and the private hospitals. Now, the question that's going out is that if this is the scheme that the union government has introduced and it has really created a lot of chaos in the last 1 month, is it time to relook at this liberalized vaccination policy? And the more important point, as you rightly mentioned, is the great debate about the digital divide, right? India has said people who need vaccination should go ahead and register on the CoWIN portal, not just register, also try for a slot on this CoWIN portal. It's a website, and only then go for vaccination, especially for people in the 18 to 44-year age bracket. Now, the question is, as you rightly mentioned, India's internet penetration is not one of the highest in the world. It's perhaps not even gone into a majority mark. At the same time, people in villages don't have access to smartphones. Many of them are still in dial-pad basic sets. Many of them don't even have smartphones. When such is the scenario, the Supreme Court is asking, how will you ensure a universal immunization program by making this particular CoWIN application on the CoWIN portal as the heart of this whole program?
You know, I think it's quite interesting seeing the Supreme Court at least standing up to the federal government. But just one more thing, Harish. Well, the government's ban, so to speak, on vaccine export is still on, severely affecting about 90 countries, according to WHO chief scientists. Now, there were talks about exports resuming in June, that's this month, if local cases drop well enough. What's the outlook right now?
Well, a practical outlook right now, or a practical assessment would suggest that there is no chance of India resuming export of vaccine or even allowing manufacturers to go ahead and export vaccine. That's for two reasons. One, there has been severe criticism in the way the government has or failed to order vaccines in time. And last month, the government managed to vaccinate only around 79 million people, while their own estimate is that they want to vaccinate at least 100 million people. Well, that's the kind of scenario you're looking at. At the same time, the government is also worried about the kind of domestic implications here if vaccination or export of vaccine is allowed, because the government is under scanner and there's a severe shortage. There's a scramble to arrange for vaccines, even talk about importing it from other countries.
Well, Harish, it's been great talking to you on this. Thank you so much for your time.
Thank you. My pleasure.
Well, 7 more countries have been added to the UK's foreign travel red list. The countries are Afghanistan, Bahrain, Costa Rica, Egypt, Sudan, Trinidad and Tobago, and Sri Lanka. Well, it comes as the UK's Prime Minister Boris Johnson celebrates as the country reaches the milestone of half of all adults being fully vaccinated against COVID-19. But don't forget to protect yourself. The virus is still out there, so continue to take responsibility and visit our website, channelstv.com, for more updates and better understanding of the pandemic. We also have all the big stories for you, all at your fingertips. Well, that's a COVID-19 update. Thank you for watching. I'm Kayode Okikiodu.